sleep and the importance of establishing a routine. Why is sleep important? Sleep is an important component of health. Sleep is essential to grow, to restore our body and immune system, and to enhance and solidify memory and learning. When we don't get enough sleep, a whole range of problems can result. What is the prevalence of sleep problem? All parents deal with children who have difficulties falling asleep or staying asleep. This is normal with children that have ASD or with typical children. These temporary sleep difficulties are normal. However, children with ASD have more ongoing sleep-related difficulties. Significant sleep problems can occur in 40 to 80% of children with a diagnosis of ASD. And in typical children, it is between 20% and 40%. Sleeping difficulties. What is a difficulty in sleeping? For children with ASD, insufficient sleep can impact daily behaviors or daytime behaviors, making challenging behaviors worse, thereby adding to the stress and challenges experienced by the parents and sibling of a child with ASD. How much sleep is needed in general? Every child needs a slightly different amount of sleep. In general, these are the amounts of sleep children require by age. A child between 1 and 3 needs about 12 and 14 hours of sleep per day. A child between the age of 3 and 6 needs an average of 10 to 12 hours of sleep per day. A child between the age of 7 and 12 would need an average 10-11 hours of sleep per day. A teenager between the age of 12 and 18 years old will need an average of 8 to 9 hours of sleep per day. And adults, we need an average of 7 to 9 hours of sleep per day. What are sleep difficulties? The most common sleep problems in children with ASD are difficulties in falling asleep. Sometimes they will have tantrums, refusing to go to bed, refusing to following their daytime routine. Repeated awakening during the night, so they will wake up in the middle of the night a couple of times during the night. Prolonged awakening, refusing to go back to sleep, so they will wake up and it will be difficult for them to go back to sleep. Awaking very early of the day, and hypersomnia, it's oversleeping. Sleep difficulties can affect the family. When a child has difficulty sleeping, the sleep of other family members are also impacted. Studies have demonstrated that parents of autistic children sleep less, have poor sleep quality, and wake up earlier than parents of non-autistic children. How does insufficient sleep can affect a child? A lack of sleep can have the following effects: daytime sleepiness, lethargic, poor learning and cognitive performances, hyperactivity, inattentiveness, lack of focus, aggression, depression, irritability, reduced tolerance levels, increased behavioral problems, and increased repetitive behaviors, reduction of impulsive control.
So there's many theories regarding what causes sleep problems in children with ASD. One could be social cueing problems, which is the difficulty settling down at night and also waking in the morning. They can also have irregular circadian rhythms, which is basically a natural rhythm that all people have that regulates our sleep. They can have difficulties with sensory issues, so they can be hypersensitive or they could be hyposensitive to different objects, things, textures within our environment. Food and drink can also have an impact on sleeping difficulties. Hypersomnia, which is also sleeping too much. They can sleep too much during the day or they can sleep too much during the night, which actually does cause difficulties. Lack of structure or routines, which is probably the biggest difficulty that children with ASD have, and that is probably the number one problem for parents to implement. And then there can also be medical or psychological issues. Social cueing problems. Children with ASD may have difficulty understanding why and when they need to sleep. Problems with social cueing, which is the why and in what order things should happen, are common with autistic children and may mean that your child that may not make the connection between their family going to bed and the need for them to go to bed. Therefore they misinterpret the social cues that are existing in their environment. Some people may also find the transition from sleeping in their parents' room to their own room by themselves very difficult. Often children start out with their parents, and usually the transition from infancy to childhood is very, very difficult. This can be related to difficulties with changes, but it can also create a need for reassurance around the bedtime sleeping routine. The circadian rhythm, which is the natural rhythm in which all people need to have in order to sleep properly, it basically controls the release of hormones, which is called melatonin, by the pineal gland, which is according to changes in daylight. So our bodies produce less melatonin during the day and more at night. So when more melatonin is produced, our body temperature dips and we feel drowsy, enabling us to sleep better. Studies have shown that children with ASD are more likely to have disturbances in the natural wake or sleep cycles and abnormal melatonin regulation, which means producing melatonin at irregular intervals. So this imbalance leads not only to difficulty in sleep problems, but also to sensitivity to light and temperature. Research has shown that the administration of melatonin improves sleep latency, or the ability to fall asleep, in children with ASD and helps to normalize their sleep and wake patterns. Research done so far finds that it is safe and effective. But the use of melatonin should be discussed with and followed by your medical practitioner and should be used in conjunction with other behavioral strategies. You can also discuss with the pharmacist whether they think it's also appropriate as well. Now, sensitivity issues or sensory issues are very common for children with ASD, and they usually can have very significant problems with hypersensitivity to touch, visual stimuli, or sound. This can also be distracting and distressing and make the process of falling asleep very difficult. So that would be a sensitivity to noises in the environment, like fans, lights, outside noises outside their room. So you need to examine your child's sleep environment more closely to see if adaptations or modifications can be made or are needed to assist your ability to relax at bedtime. They also might need a systematic treatment for sensitivities to help alleviate the aversion that interfere with daily life. This would be provided by professional psychological interventions. Sensitivities to environment really means that you need to ensure that your child's bedroom encourages sleep. So in order to do that, you need to check the temperature. If it's too hot or too cold, you need to assess the temperature of the room, bedding, sleeping clothes. And remember that your child's sense of temperature may be different than your own. You need to consider their tactile sensitivities that may be affecting your child's ability to sleep. Certain textures can relax or arouse a child. Look at bedding, pillows, pajama textures. Do they prefer feet covered or uncovered? How tight or loose is the clothing? Does the clothing have elastic? Is the weight of the bedding giving them the optimum level of pressure that they need? You also need to consider noises and how they affect your child at night. When trying to relax and fall asleep, the noises your child hears may be overpowering and impossible to filter out. For example, running water, scratching noises, the least little sounds that you might not even notice would be very, very pronounced for an autistic child. Sometimes a fan or air filter on a furnace or soft music in the child's room can help mask the other noises and provide a consistent sound that is comforting and or soothing for the child, so it's not as bothersome. Also consider visual stimuli that may be causing problems. For example, is the room too light or too dark? Depending on the child, there may be other distractions in the room. Are there too many toys? What kinds of toys are in the room? Are the pictures overstimulating? Are there lights coming into the room? You need to keep in mind that sensitivities are individualized and not all children react to the same stimuli the same.
Another possible causes of sleep difficulties can be food and drink. What you eat and when you eat can play a role in worsening or improving your sleep. A nighttime treat can either turn into a sleep disaster or help to induce sleepiness and maintain sleep throughout the night. Snacks, meals should be given at least 2 hours prior to sleep. Things to avoid. Avoid caffeine not less than 6 hours before bed. Food dyes, preservatives. Heavy protein snacks, sugary snacks, refined carbohydrates, fried foods, and large amount of fluids. What you can choose: oatmeal with maple syrup, bananas, tea, example chamomile tea or passion flower tea, almonds, poultry, fish, all aid in the development of natural melatonin. Another condition that can affect sleep is hypersomnia. What is hypersomnia? It's a condition where you find your child sleeping far longer than what you normally expect. It occurs when children consider their bed and bedroom is the place they feel the most comfortable and relaxed. Child can have difficulty waking up, causing extreme behaviors if you attempt to. Older children and teenagers are more susceptible and can be related to severe anxiety, fear, and or depression. You need to make waking up process as gentle as possible using quiet music or an alarm. Use breakfast as a reward for getting up and have an established routine. It's very important to have a routine. When there is sleep difficulties, having a routine is a need. It's creating a nighttime routine with help your child transition from the day to the sleeping time. This will help establish expectations and positive sleep patterns. The routine can increase comprehension and understanding of the structure, helping to reduce behaviors. It can also help teach a child to get ready to sleep. And it can help to structure the entire family. Medical issues. It is important to verify if there is medical issues that will cause sleeping difficulty. Check for food and or environmental allergies or intolerances. Gastrointestinal disturbances caused by reflux, seizures, night terrors, medication that cause sleep disturbance, for example, caffeine-based pain medication, Excedrin, Anacin, Motrin, and ADHD medication. Regular sleep disorders, for example, sleep apnea, insomnia, causing snoring, mouth breathing, restless sleep, and pause breathing. Mental health problems, for example, bipolar disorder, severe anxiety, can have an impact on sleeping. Therefore, it is very important to consult with the GP or the general practitioner to investigate those medical issues.
Establishing a routine or a schedule is probably one of the most important things that you can do to help your child to sleep. Bedtime routines are important for most children in establishing positive sleep patterns, but they're especially critical for children with ASD. Following a daily schedule will help an ASD child prepare for the next task. The schedule can help with bedtime, meal times, and transitions, and are usually presented in a picture form. Pictures also allow nonverbal children to see what is coming next based on the current activity, giving them an extra time to process the change. Creating a schedule for the home will also bring order, quiet, and structure to your household. Children with autism respond well to routines because they allow them to feel safe and in control. Creating a routine that you can use every day and anywhere will be critical for them to maintain that sense of security. The activities of the routine should be predictable and personalized to the individual interests and needs. Your bedtime routine doesn't have to be long. It can be between 30 to 60 minutes, and it things like taking baths, brushing teeth, changing into pajamas, reading a book, or singing a song. Even if you get home late, try not to skip the routine, because it's very important, even if your timing changes, that the routine stays the same. It is also very important that you or your partner or any other people looking after your child try to follow or maintain the same structure or routine. You may need to experiment in order to figure out which elements of the bedtime routine are working and which ones aren't. You want your child to be relaxed and ready to sleep at the conclusion of your routine. So, for example, if your child becomes too active after bath time, you may want to move this to an earlier time slot so that they have a chance to sort of relax afterwards. You need to provide positive reinforcements to help increase the motivation and promote the completion of the routine. So follow things by activities that they don't like, for example, brushing the teeth, with stories or maybe little games, or sitting with mom in bed can provide different types of positive reinforcement. You can include small variations in the routine each night so that it doesn't become like a ritual that can't be changed, which can also lead to other difficulties. The bedtime environment should also be associated with sleep and comfort, and you need to try to avoid introducing negative associations like timeout locations. Try not to use the bedroom as a timeout location in order to establish a positive environment for them to be able to sleep. Strategies to remember: you need to set a regular age-appropriate time for each night and stick to it. You need to establish positive bedtime routines, such as giving your child a warm bath or reading him or her a story. You need to make after-dinner playtime a relaxing time. Too much activity can cause children to stay more awake. You need to avoid meals close to bedtime, at least 2 hours. You need to set bedroom temperatures so that it is comfortable, and make sure that the bedroom is dark for those children that need it to be dark, or light for children that prefer it to be light. You need to try to keep the noise level down low, and you need to try to keep external stimuli like computers, TVs, iPads to a minimum, because this can be often overstimulating, making it more difficult for them to sleep. A regular nap schedule should also be created for children 3 and under, as it helps to improve nighttime sleep. Basically, if they're overtired during the day, they tend not to sleep as well during the night. And it also increases the difficulty for them to be able to fall asleep. So at least 3 hours should have elapsed between the last nap and bedtime, if not more. Try not to engage in overly stimulating activities or discussing topics that can be distressing prior to bed, sort of like homework. Doing homework right before bed is probably not the best idea. Avoid watching TV or other screens prior to sleeping. And avoid getting into bed with your child or rocking them to sleep. Try to encourage them to sleep in their own bed on their own. Try to ensure that your child gets plenty of exercise during the day. Not too close to bedtime, but having exercise during the day will increase the amount of fatigue and therefore increase the ability to be able to go to sleep. Make sure that your child's room is safe and secure. You also need to give plenty of warning that the bedtime is approaching, and you need to be consistent in how you present the cue. Whether it's verbal or visual, or it could be a story, just something that lets them know that the next step is going to be sleep. You need to provide a calming environment by practicing relaxation techniques consistently. It could be like kisses at night, it could be a hug, it could be, some parents use yoga before bed, it could be a story. Teach your child to fall asleep alone so that they will be able to return to sleep during the night. And start sleep training early and be consistent in order to help your child learn how to sleep through the night.
Having a bedtime routine is important, or a daily schedule. This is an example of a routine after school or daycare. For example, After school or daycare, there could be a period of homework or an arts and craft activity or a preferred activity with the child. Then it could be outside play. Therefore, it's reinforcing the task that was done before with an interesting activity and fun activity. Quiet reading, for example, at 5 o'clock. At 5:30, it could be computer time. 6, cooperative play with siblings. 6:30, prepare for dinner. Wash hands, help set the table. It's important to include the child in your daily routine as well. For example, during supper preparation, it makes them feel responsible and part of the routine. Then it's dinner time. After dinner, bath time, brush teeth, put pajamas on, and around 8:15, it could be the bedtime routine. So then it's bedtime and good night. Positive sleep training can be more difficult for the parent than for the child. It is very important to remain consistent. Consistency is the key. After the routine has been completed, leave the room with little verbal and physical interaction. Limit yourself to 1 kiss, 1 hug. Check on the child periodically, going back into the room briefly for 30 seconds to a minute, giving a high five or a thumbs up, or a hug while gently but firmly saying, "It's okay, it's bedtime, you are okay," and then leave the room again. Checks can be made every 5 to 10 minutes or until she or he falls asleep. This will help them feel secure. If the child gets upset and gets out of bed, quietly and calmly put him back to bed with less interaction and remain consistent. Social stories can also be used to reassure them about the sleeping routine and about safety when they are sleeping alone. Provide objects to the child that will enable him or her to feel secure or less anxious. For example, blankets, preferred toys, special pillow. Make sure to have a variety of objects in order to avoid dependence. It may be difficult the first few nights. Be prepared for some sleepless night, but it's very important to remain consistent. It is important to remember that the behavior will likely get worse for a few days before it starts to improve. Poor sleep habits are easily created and can be extremely difficult to change. Try to avoid creating sleep routines and habits that will have to be changed later. Stability is very important. Do not give up. Be consistent and persistent. Remember, falling to sleep on your own is a skill that has to be taught.
Sleeping with parents is usually a problem that is created due to poor sleeping patterns originally. And in order to help the family cope with difficult behaviors regarding sleeping, the parents often resort to letting the child sleep with them initially. But it is often a habit that is very difficult to reverse due to the child's need for ritual and rigidity. It requires a lot of persistence and consistency, and it is a long-term commitment. You can use gradual withdrawal to help the child separate and adjust to sleeping on their own. You need to start planning this during a vacation or a prolonged period where you really don't have to do anything, or you don't have to go work, you don't have to get up, and you can really focus on this. First step for graduated withdrawal, you need to lie next to the child on the bed. You do this for about three nights to 3 to 5 nights. The next step, you lie on the mattress next to the bed. It could be on a floor, it could be on a blanket. You also do this for 3 nights to 5 nights. Then you move the mattress gradually closer to the door. And you do this, you move the mattress closer every 3 nights. So you'll have the mattress in one position and you stay there for 3 nights. Then you move it gradually closer to the door and you do that for another 3 nights. And then closer and closer for 3 nights until you're actually out the door. Then you can sit on a chair in the bedroom, but at the door, with the door open for another 3 nights. Then you can sit outside the door, still visible to child, for another 3 nights. And then you sit outside the door with the door closed for another 3 nights. And if the child calls out to you, then you're there and you're able to answer their calls. or you're able to redirect them back in the room and reassure them when needed. And then the last step would be to sit outside the room with the door closed, and hopefully by then the child will have gotten used to sleeping in their room by themselves. Since you're outside the door, you can still redirect them, but by the end of the whole procedure, that should be a lot less. We need to try to explain why the child needs to sleep. Children with ASD may have difficulty in understanding the basic need for sleep. So using social stories can help children with ASD understand social behaviors and teach them how to behave in specific situations, and sleeping being one of those specific situations. Social stories can be used to explain sleep and the expectations regarding it. So things you need to remember. None of the suggestions that we've presented to you can be guaranteed to work independently of one another. You may need to find a combination of them, and you might find that a combination of them all or various ones proves to be the most effective for you. And like we said before, no two children are the same. So what works for one child may not necessarily work for another. When implementing strategies, the problem will likely always get worse before it gets better, because they're just so rigid and resistant to change a lot of times that they will not want to be having any change in their routine at all, because the sleep patterns that they've developed, even though they're not beneficial or effective, for them it's part of their routine, and they have a very difficult time changing them. Once you have made the commitment to start, you need to remain consistent in your approach, and also to continue to follow through despite the obstacles. And you will most likely have a few sleepless nights during the whole process. Also, rewarding praise following the child having a good night's sleep will also keep positivity in the process. Kids like to hear when their parents are proud of them, or they like to hear that their parents are happy that they've had a good night. We need to remember that great works are created through strength and persistence, and that everyone needs to work together and consistently in order to effect change in the child as well as the family.